catch your interest?
Start with Elijah.
Elijah. All right. I kind of made a comment about an hour ago that we would kind of segue to him.
Oh, okay.
So, all right, what are your thoughts about Elijah Price?
I like him. My thoughts. Give him something else. If I wanted to do it pretty, because I actually, this is like one of the few times where, because he's kind of a villain, but not really a villain, and so I'm not gonna give him anti-socialism. But,
Let's take a timeline. Where'd this all start? For Elijah? Hmm?
I was gonna say his childhood.
Sure, yeah, childhood. What's significant about his childhood?
he's born with a lot.
All right, and as a result of his having osteogenesis imperfecta, what happened?
He comes out of the womb with fractures.
All right, give us a little bit of detail as to what brings him out of the room. What makes him leave his house?
His mother kind of entices him with a gift, and then that kind of turns out to be his first comic book, and then he develops a further interest in comics.
Right. Okay. Now, his mother, and if you've seen Glass, which is an independent film as part of the trilogy, his mother's character is developed somewhat more. But pertaining to the film Unbreakable, his mother buys him that book, and his mother puts that book in that park bench across the street for all good intentions, right? That's the idea of exposure therapy when it comes to social anxiety. This is an individual who does not want to leave his home, right? This social anxiety may be evolving to what the mother is identifying as social anxiety disorder. That something about being out of his home. Now, remember this morning, we had a differential diagnosis. So when you're taking a shelf exam, somebody that looks like they're demonstrating avoiding behavior or avoidance behavior, you may look at your answer set and very quickly spot, let's say, answer A, social anxiety disorder, or social phobia. But that might not be your single best answer, because you might see that B, C, and D have similar anxiety disorders listed, and avoidance behavior unfortunately does not differentiate. What are those other illnesses that would be part of your differential diagnosis here?
Schizoid.
Schizoid, we're going to keep that in mind, yes. And we're going to say schizotypal as well.
Agoraphobia.
Agoraphobia, good. What differentiates agoraphobia from social phobia?
Like the context in which anxiety arises?
More exactly right. What are you looking for specifically? What are you going to now look for, actively look for in your case vignette to get that single best answer?
I don't know, like if it's related to like public speaking, or even like using the public restrooms, I think.
Right. So the social scenario or performance scenario itself invokes the anxiety. Is that what's going on here? Probably not. What is the fear in agoraphobia?
That you can't escape or you can't see public immediately.
In the event of what?
In the event that you leave your house, I believe, or your home.
Or experiencing symptoms.
Yeah.
Right? And the easy example there is panic disorder. Right? That's why you always hear panic disorder with agoraphobia. That's the easiest example, but it could apply to any illness, including the embarrassment that may result from osteogenesis imperfecta. So this differential is likely to include the idea of agoraphobia. And as part of agoraphobia, as part of the biopsychosocial treatment plan for agoraphobia, the clinician, aka mom, is looking at exposure therapy. If I get my son out there, he'll realize that it will not be the end of the world to leave his home. And that exposure will then, I think, feed back and address the cognitive distortions of what it would be like to leave the house. She does that. Unfortunately, it backfires. Because while it actually does get him out there, while it does allow him to leave his home, the object she uses becomes an object of his fantasy. Here, I'm using fantasy as a defense mechanism, so it backfires. In this case, little boys his age, a young Elijah, can resort to fantasy to alleviate anxiety. They can have an imaginary friend. That's not what happens here. What instead happens is that the child gets lost in a fantasy world, or the fantasy world of the graphic novel. And while at the age of 5 or so, it's perfectly fine, it's perfectly normal, we then see that at some point it crosses the line. Any questions with regard to the early developmental history of Elijah and how all of this stemmed from osteogenesis imperfecta? We are not going to say that Elijah is suffering from a mental disorder due to an underlying medical condition, because it's not necessarily the direct physiological effect of the osteogenesis imperfecta, but it's his adjustment to it. So initially, if he went to see a physician, maybe adjustment disorder would have been a diagnosis, but then the formulation of that would have been a little bit more complicated. And the detail provided in that case formulation would include defense mechanisms like fantasy, and how the attempt at exposure therapy likely backfired here, or at least posed risk, identifying the maladaptive use of fantasy at some point. So where does it go from here? What happens?
Like, you think he could develop almost like an obsession regarding this theory about how he has to have like an opposite,
Where does that come from? That's exactly what happens. Where does that come from?
like from like his comic books, like the idea of like the superhero and the villain, like the villain is the complete opposite of the hero.
So he adapts a theory from the graphic novel. Absolutely. Why? If he were seeing you, what might you have provided in your therapy that may have actually avoided all of this? The child is angry. He is frustrated. And he has a significant concern with regard to why me? Why did they do this to me? There might be guilt involved. There's a lot of anger involved. And he arrives at this idea that he actually balances the universe. Because without that, he has no role. This is an existential question. Who am I? What good am I? Why me? When he develops this idea, when he adopts it from the comic book, or the comic mythos, he now has an answer. He now actually has a sense of self. That even though the osteogenesis imperfecta resulted in everything, including but not limited to the incredible bullying that took place. They called me Mr. Glass. On the larger order of things, he is necessary. He is necessary to balance the universe. And the only way in which he could prove this is if there is a polar opposite. And that's why he does what he does. If he doesn't find David Dunn, and he can't support his theory of who he is, then he is no one. And I don't know when this idea occurred. I don't know if it was young adolescence. I don't know if it was young adulthood. I'm not sure exactly when it occurred, but up until that point, this individual simply did not have a sense of self. Right? Nobody ever came up to him and said, look at you, you're a future doctor. Right? That may have been something that you in this room have heard before. Nobody heard that you're gonna be the first in the family to go to college. There's nothing for this child, nothing, until he discovers who he is in comics. And at some point, this likely evolves from probably a schizoid personality, that maladaptive personality state that is the direct result of fantasy as a defense, or more specifically, the maladaptive use of fantasy. We talked about that being a risk factor for schizophrenia, and I think and that would include other psychotic disorders. And at some point, this belief that there must be somebody unbreakable to balance the universe becomes a delusion. Albeit one that turns out being true, but a delusion. And in terms of the biopsychosocial formulation of delusional disorder, we know that the psychological component, the psychological factors that may predispose, remember the 3x3 rubric, is a condition called a schizoid personality disorder. Other thoughts about Elijah Price? You can see how if he were to show up or present to clinical practice, how maybe not in the initial psychiatric evaluation, but at some point, this would be your case formulation. We're probably looking at a delusional disorder. I don't know if it's grandiose type, but maybe other.
You make an argument for narcissism, just because the fact that he says that he needs an opposite, like he needs to have a zero to his story. The fact that he believes that he's this well villain in this game.
Yeah.
That
Yeah, I
point.
think you
And
made it
then-
easy, basically, yeah.
And only another person that he deems as worthy as him could understand him. I think you make a good argument for it.
Absolutely, absolutely. Now, whether his narcissism is due to the narcissistic personality disorder, or whether it's due to a delusional disorder, grandiose type, is another question. But there's definite narcissism there, and we've talked about this before. What you just described in psychotherapy is referred to as twin-ship transference. The need for the narcissist to see the other as their equal. Because that's when you actually have some rapport. And in a therapeutic milieu, you can actually then reach some treatment goals. Now, outside of the therapeutic relationship, when the narcissist turns to you, especially in film, and tells you, you know, in a lot of ways, you and I were a lot alike, it's time to actually look at your the clock, set your stopwatch function, and find the easiest route out. Because, and we should do this, we should just absolutely nerd out one time and pick 10 films that do this and find the average number of seconds it takes before a murder attempt occurs. Because that's what's about to happen. You know, you and I were a lot alike. It's not a good thing to hear from a narcissist in a movie. And here we have Elijah Price saying that, so yes. Narcissistic personality disorder, not sure. But definitely the delusional disorder, grandiose type. Which is ironic because we wouldn't expect someone with what his developmental history was to be grandiose. But you could see how adopting that delusion of there needing to be somebody unbreakable, that I have a place, because I balance the universe.
So when you're talking about the murder attempt after that moment of time where the narcissist says that to the protagonist, would it be fair to say it's likely usually due to the protagonist denying the reality that the narcissist is proposing?
Yeah, in therapy, you don't confront your patient and say, you know, I'm nothing like you,
Yeah.
right? Even in 7, we talked about 7, Mills just goes right after John Doe, and Doe tells that to Detective Mills. Goes right after you, I'm not nothing like you, you're a psycho, quote unquote. We don't do that. We actually realize that twin-ship transference has been achieved. That was one of our objectives to reach the ultimate goal. But in movies, far different. And this movie is no different. Trying to plead with the hero, anti-hero, that, we're one and the same. We're, the Joker is to Batman.
I was gonna ask, could you make a case for like OCD just because of the fixation on the whole?
I don't know if I would call it obsessive compulsive disorder, because the fixation, I think, is describable and explained in the context of another disorder. I think it's part of the grandiosity that itself is part of the delusion. Yeah, so I'm not sure I'd come up with a separate diagnosis, because I think it's readily explained. For John Doe, on the other hand, that's a little bit of a better conversation, because of the premeditated nature he takes with his victims. That he needs an element of perfectionism. And that helps define in this case, the serial killer. On the other hand, if we compare these two, we probably should relate these terms again. Antisocial personality disorder, whether we're talking about John Doe in David Fincher's Seven, or Elijah Price in M. Night Shyamalan's Unbreakable, both have antisocial personality traits. Now, whether they had conduct disorder prior to the age of 15, and therefore true antisocial personality disorder, another discussion. But either case, that is an illness. Okay? It's a mental illness. Psychopathy is not. Psychopathy is a clinical term, not a diagnostic one. And the difference between the two is pretty much twofold. Number one, psychopathy is considered to be the more severe form of antisocial personality. And its severity is explained by the additional qualities that focuses on the patient's behavior and less on their character traits. The character traits are the DSM criteria for the antisocial personality. Those plus identified behaviors equals psychopathy, hence why it's more severe, a clinical term. Psychopathy then can be further differentiated from sociopathy or a sociopath, despite the fact that there is almost zero consensus about what a sociopath is. So not a term that has true consensus in medicine. Nonetheless, it is used, and it is especially used in Hollywood. And since we're using films to teach, we have to address this. We talked about this before, about the sociopath is thought to have some element, some capacity for empathy, despite having no compassion. And it's that empathy, that ability for them to read another person, their victim, that results in their behavior or influences their behavior, their predatory behavior. Not the same for a psychopath who is considered to be devoid of empathy. They can't read people's faces like that. So the type of murders that usually, again, this is not perfect, but usually occur at the hands of a psychopath is usually serial bombing, serial sniper. It's exactly who Elijah Price is. The sociopath, on the other hand, usually kills from a relatively shorter emotional and physical distance. So they'll invade the home. They'll actually stalk. Not so much for the serial bomber, the serial sniper. Not so much for the Elijah Prices of the world, the psychopaths. So there's a differentiation. The idea is that there's an element of the schizoid personality with regard to the ideology of the psychopath. And boy, is that ring true for this case study, as we previously discussed. So schizoid perhaps provides some risk factor for developing what is a quasi-consensus to be the psychopath. So any thoughts about that? Any questions? So we talked about Old Boy and the historical significance of that film. What's the historical significance of Elijah Price's character? So I know we had talked about this. A few students have talked about this, but I guess larger consensus, not yet. This is the case study of Lawful. Anybody here familiar with Lawful? Do not look it up. Hands up.
Not big enough.
Lawful was a student at Harvard when he signs up for a research study in the Department of Sociology. He is told that the study is going to be in two phases, the first of which is to keep a diary, keep a journal of every intimate thought you have. At the conclusion of the initial phase, he'll enter into phase two. He'll be paired with a partner and defend his motives, his belief system versus that of his partner. A few weeks pass, he gets a phone call to meet his partner at a particular hall, particular part of campus. He goes there, nobody's there. After a little bit, a few people who are dressed in black suits approach him. They usher him into the hall. They bring him to a particular auditorium lecture hall. Seated to capacity, 300-400 students. He sits in front of them, he is tied down, his journal is taken from him, and physiologic parameters are recorded. Pulse oximetry, skin galvanization, heart rate, blood pressure, and over a live mic, his journal is read word for word. There are 22 subjects in this study. He ranks 22nd and last with regard to the worst response of the psychological torture, which was the true nature of the experiment. Dr. Murray, professor in sociology, had worked for the Pentagon, and who had his focus and research on brainwashing that occurred in prisoners of war, and why when released, they did not return home. So he was looking for personality variables that would predict such brainwashing versus protective factors, and he constructed this particular form of research. Following a sophomore year, we don't know much about Lawful at Rutgers, Freudian slip, at Harvard. His documents are sealed, so we know nothing about him. We do know that he gets his PhD at the University of Michigan, where he gets a degree in some branch of astrophysics, and there he excels. There he excels. His research mentors on record as saying that about 6 people in the entire country would be able to understand his research thesis, much less defend it. Excellent. There he goes to Cal Berkeley, and things begin to unravel. Why? He's put on as an assistant professor, and they don't go well. Easy question. What is the bane to any teacher's assistants? Huh?
Students?
These guys. Not you, of course. Tongue in cheek. You can't tell because of the mask. He does have a difficult time talking to students, looking them in the eye, face to face. He stammers. He actually stutters. He pacing. He paces a lot. Students approach him after class. He actually literally runs away. He keeps office hours, door locked. People knock. He stays in until he's assured everybody's gone. This does not sit well with students. They go to a supervisor, and ultimately, he resigns. The president of Cal Berkeley states that upon accepting his resignation, that he was bright enough to attain full professorship at the earliest age in the history of the school. Unfortunately, socially, he can't function. Where does he go from there?
Yeah, like private business.
Where? Not private business.
Overseas.
Not overseas, stays within the United States.
Government.
Not work for the government.
New York.
Huh?
New York.
Does not go to New York. Huh? No home. Or where does he call home?
Harvard.
Not Harvard, he doesn't go back to Harvard.
Okay.
Probably still sending him, well, I guess it wouldn't be by email, but probably sending him requests for donations of him alone right now. Somebody said alone. Give me some ideas of where you'd go. Where, what? You got it. It's in the woods. He lives in the woods. Exactly right. Where?
North Dakota.
So close. You're so close.
Idaho.
So close. Now I can come west. Backwoods of Montana. Lives off the land in a makeshift hut that he builds, square footage maybe twice this. No running water, no electricity. One day, he comes across a hiker and decides that it's way too overpopulated for him. So he's gonna go back to his original campsite. It's like a 5-day hike. And when he gets there, what does he see? Since he's been gone, that a road has been built. And as soon as he sees that road, he begins to write his manifesto, declaring war on technology. He begins a serial bombing campaign. First, universities, and then airlines. And he becomes known as the University Airline Bomber. And FBI shortens that to the Unabomber. So this is the case study of Ted Kaczynski. Schizoid personality, and then once apprehended by the FBI, diagnosed with schizophrenia. Not terribly unlike Elijah Price. Serial bombing, emotional and physical distance is significantly greater than an individual who might be termed or classified as a sociopath. So a lot of similarities between the fictional character and M. Night Shyamalan, probably intended, and the case of Lawful. So we have two cases today. First from Old Boy, then Unbreakable, that have some relevance with regard to significant events in our country's history. This latest is a serial bombing campaign of the Unabomber. I believe he's still alive. Very interesting of a psychiatrist to be able to interview him to get his take on how things are going for him these days with Facebook and Twitter.
Curious about the history and the story. In the first case you mentioned before, there was a clear moment where the psychiatry team evaluated him and made certain decisions where, and he went on to do things that he did. In this case, was he ever a patient?
Not to my knowledge, no.
Okay.
No, I think psychiatry interviewed the Unabomber, Kaczynski, after his apprehension.
Okay.
Yeah. Any other observations in Unbreakable? Any other characters you want to discuss?
David.
What's going on with David Dunn? Maybe specific phobia to water? Start with that low-hanging fruit. I'm not sure exposure therapy is going to work for him.
I guess we can talk about how, for some of the events in his life, like from his younger days, he almost had to be reminded of the details. I don't know if that makes sense. Like there was like a bit of confabulation, for example, when he thought he had broken his leg in an injury and ended his football career that way.
So there's definitely an element of dissociative amnesia here. Right? And whether that's dissociative amnesia as a true diagnosis or in the context of a post-traumatic stress disorder, I think needs to be evaluated. But there's definitely a component of dissociative amnesia. Anything else? Seems to also have forgotten that he's married. Not sure if that's dissociative amnesia or just selective forgetting. So not the most loyal of marriages from David's perspective. What's going on there? So he's likely to come to you with a chief complaint of interpersonal difficulties, Doc, I'm having problems with my marriage. Maybe in the context of couples therapy, maybe not. And after spending some time with this character in that context and knowing now what you know, having watched the film, what are some of your ideas? I have one poor choice of friends. Be careful who you're hanging out with these days. Sounds like that new friend of yours might be bad news. What else though? The irony here, and again, I don't think it's coincidence, is that you have a real intriguing case of an existential crisis in Elijah Price, who really does not know his place in this world. And oh, by the way, neither does David Dunn. When Elijah, and I'll paraphrase, tells David, you know, you and I, in a lot of ways, we're alike, perhaps he really means that crisis that they are both in this case, in their midlife. David Dunn does not know who he is. Why? It's not due to osteogenesis imperfecta.
I'd say his decisions in life weren't necessarily based around his own formulation of his identity and his choices. He seemed like giving up football and things of that nature was really revolving around his relationship with life. Maybe, I mean, even if they weren't conscious decisions of his.
You think they were conscious now? It sounded like his wife gave him an ultimatum.
Yeah, sure. But it wasn't something that he could stand up for himself. I don't know.
He may have felt that way.
Yeah.
What is going on with David? I mean, he tells us he tore his MCL, right? In an auto accident. We find out that's a total lie.
We know that's not possible.
Right? So what's the single best diagnosis for David Dunn there?
Like some kind of somatic form disorder.
Somatic symptom of related disorder. What related disorder do we think he's suffering from? Is motivation a conscious effort? Consciously motivated? Or is it subconsciously motivated?
Probably subconscious.
Yeah, so maybe it's fictitious? I'm not so sure it's subconscious. But I think that's a question now. Because if not, he's malingering. If he did this because he wants to marry his wife, present wife, then this is malingering. In either case, he's not likely to be happy. He never fulfilled his potential. And Erickson says that when you reach midlife and you look in the mirror, you begin to think, is this it? Is this what's staring back at me in that mirror, the fulfillment of my dreams? And if the answer is anything but a definitive yes, get ready. He called that stagnation. The lay public calls it midlife crisis. Clinically, likely major depressive disorder. Synonymous. Generativity versus stagnation. We have a character in midlife who's stagnated. He's getting divorced, they're separated. He's returning, I think, from New York. After having looked into a job, he's leaving his family. So he's ready to close that chapter of his life. Largely because he lied. Again, whether it's motivated consciously or subconsciously, not sure. So whether it's malingering versus fictitious disorder, itself defined through the subconscious motivation, he feels that he is not in the right place at this point in his life. If this were to continue, going from midlife to late life, stage 7 to stage 8 in the Ericksonian psychosocial stage theory, what is likely to happen for David Dunn in the future? Before he finds out that he's unbreakable, of course, because that changes things. What's the 8th stage per Erickson?
integrity versus despair.
Yeah. It's got there. Ego, integrity, I'm ready to leave this earth. How am I gonna, what's my legacy? Unfortunately for him, his legacy is born due to Elijah Price. He finds out that he's an awesome superhero. Lucky him. For many of us, that's not gonna happen. And we're looking at ego, integrity versus despair. And that's what this character's about. Now, we could also talk about, upon his meeting with Elijah, whether he too develops a delusion that he is in fact unbreakable. It's certainly worth a conversation, but I don't think we need to go down that road, because the same principles apply that we previously discussed in the context of Elijah. And we see that kind of come to a head when his own son points a gun at him at breakfast, what he truly believes. Any other thoughts about David Dunn? Any other characters you'd like to discuss? We're good? All right, we'll take a break. We'll come back. For those following at home, we'll just regroup a little bit. What time we have? 1:10. 1:10? All right, we'll say it, we'll give 10 minutes. At 1:20, we'll have our case presentations. See everybody back then. Good job, guys.